Talking about mental health is no longer taboo, but somehow Black men are still left out of the conversation. Enter Emmy Award-winning actor Courtney B. Vance, whose book, The Invisible Ache, Black Men Identifying Their Pain and Reclaiming Their Power, seeks to change that. Courtney wants to revolutionize mental health in the Black community. Can it be done? And if so, how? Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health and the senior advisor at Walgreens.
Join the ever-growing CareTalk community on LinkedIn, where you can dig deep into healthcare business and policy topics, access CareTalk content, and interact with the hosts. And please be sure to leave us a rating on Apple or Spotify while you're at it.
Welcome, old friend Courtney B. Vance.
It's great to actually welcome an old friend, and I just was humbled by how much you opened yourself and your own experiences in the book Invisible Ache. What inspired you to kind of open the window and let the rest of us in to what's it's an amazing professional journey, but also a very hard personal story to share with so many?
Once my mother, and thank you, John and David, thank you for having me here. But it's a ministry now. My mother challenged my sister and I when we were home nobody needs to get that phone call, that your loved one died by suicide. But she called us, and we went down there to get her, his affairs in order, and took us a month. And as we were leaving, my mother said to us that she would like all of us to go into therapy, find a therapist and talk to someone professionally about this. And I had never known that I needed to talk to anyone. I was raised to achieve, and by achieving, everything seemed to come to be okay, even though things were a little dicey. They just keep achieving and keep achieving. And it got me to Yale, got me to Harvard undergrad, got me to Yale School of Drama, got me in Fences on Broadway, got me to with James Earl Jones, 6 Degrees of Separation for a year and a half, and then I got the phone call. And at that point, all of us are sitting on the edge of our bed eventually at 2 a.m, and we have to make a decision. What are we going to do? What are we going to do? Everyone, if you live long enough, is going to have to make a decision about what their situations, how are you going to deal with the situation? And when my mother challenged my sister, Cecily Vance Pinchion, and I, we responded. We went back to our respective cities, and the journey of actually finding a therapist is a whole other thing. But I ended up with a short Jewish lady, Dr. Margaret Kornfeld, 5 feet from the ground, and she was my person. As soon as I shook her hand, I knew. And we worked off of my dreams, and she challenged me quietly, gently, and I got to the place where after 3 years, it was my time. As soon as I started talking to her, our first session, I was talking a mile a minute, and she said, "Courtney, you don't have to tell me everything today." And that is the journey for everyone, but for Black men, there's so much on us. There's so much that we have to endure. I remember I was sitting on her stoop, waiting for a session, because when you're on time, you're late, and when you're early, you're on time. So I was sitting on a stoop in Gramercy Park, and if you know anything about Gramercy Park, you can't get into the park because it's locked, and you need a key, and only the people who live around the park have the key. So I'm sitting there, and white folks are walking by me, clutching pearls, and walking in wide berths.
Contextually, though, you are a star.
Yeah, on top of the world. On top of the world.
Famous in New York.
On top of the world. At 30 years old, on top of the world.
6 Degrees of Separation, right?
Ran for a year and a half. That's correct. Ran for a year and a half, and was in it for, at that point, a year. And so I went into my session in that and then we talked about that. She said, Courtney, how you doing? I said, I'm not doing well. And I broke down. She said, what? And so we had to start talking about what it is to be black and have black male and have people following you around in stores and not just and enduring that and it really is about how men deal with that with nowhere to go. Now I was blessed in that I had an opportunity to. I found my person. I can afford my person, and when she said we need to go 3 sessions a week, I could afford that. But for the majority of the folks who can't afford the journey, sitting down with 5 or 6 people to find your person and then being able to afford it. That is what Dr. Robin and I, when we go around and talk, we talk about contextually how black men, what can we do? How can we, and folks of color, how men of color, how can we find our person? And even if you can't find it professionally, how you find it, your barbers, your hairdressers, you're just people someone you can talk to.
But I was just, and I'm so sorry for the loss of your father, but your father sounded like just such a remarkable man. And when you punch a hole like that in your life, I just can't imagine getting that call. But how heroic that your mother was like, okay, this is the program.
Yeah.
And
and we all went in.
Yeah. And there's a wonderful line in your book, I think it's from August Wilson, about, befriending and quieting your ghosts. And I was really moved by that because that to some degree, we've all got ghosts. And at least I think in most of our cases, they're not our friends.
Right.
And it just to take that on was pretty remarkable. I also think that you articulate in the book why we've got a bigger problem with African Americans and African American males. And it's not just, I think, the courage as a male, as an achieving male, to go get help, but also that the system itself doesn't necessarily encourage trust. And maybe you could talk a little bit about, there's really, that's second, there's the barrier of ego, which we all have around achieving and shame. But there's the other one of just, do you trust the system that's supposed to be taking care of you?
It is in the black community, hospitals is where you go to die. And doctors are folks who experiment on us. So we have a very challenging history with the medical profession. And today, there's all these discussions of black women and pregnancies and not getting the care that white women would get. So it's a thing. It's a real thing. So you add that on top of not feeling.
Just to put a point in it, Serena Williams did not get care and almost bled out.
Exactly.
When she told people she felt sick. I mean, it's at the highest levels. If you hold for class and education and money and status, it's still a problem.
It's a thing. It's a real thing, and it really is about us as a society saying everybody matters, and everyone deserves great, not good, great health care. But it's a bias. It's it depends on how you were raised, because healthcare is individualistic. Healthcare is about one-on-one, one person talking to another person. It's not the numbers. It's about this doctor talking to this patient. And if you see this patient in a certain kind of way based on how you were raised, that's how you're going to treat them. That's kind of care, because the nurses are going to go based on what the doctor tells them to do. And that it's treat everyone like it was your mother. Hello, somebody. Treat everyone like it was your brother or your sister. How would you like them cared for? Now, we understand that, that doctors have pressures on them in terms of, medicine is changing. The business of medicine is changing. Everyone gets that. But when you look at the numbers in terms of how folks of color are dealt with and the care they get, and you just, that the whole, I mean, the medical apartheid, a book, that is it just breaks it down, the history of it, Madness, by a young lady, Miss Hilton, who wrote a book this year that came out a couple of months ago, and she details her family's journey with mental illness and the healthcare system in Baltimore. So it's there is a thing on top of everything about the ego and men, not just black men and prostate cancer, the numbers, just not wanting to go bend over and get poked, and and then my thing with all of that is I don't want a white coat shaking his or her head saying, if only you had come in sooner. That's so find a way to go to, I mean, just it's huge issue, when something comes up, it's
We're
already too
jumping
late.
around, the issue of prostate cancer screening and colonoscopy is a major challenge in the African American community because folks don't even trust the system enough to be evaluated. It's a part of the invisible ache is that I think was very powerful is we've got a visible problem if you just look at the math that across depression and suicide, but also around some of the biggest killers in in the American society, which are heart disease and cancer. If we just get more folks screened, more folks will be saved.
But the larger issue is, in order to get screened, that means you have to have a doctor you trust, and you have to have a doctor. You have to have, you have to have money for the insurance, and so it's a huge cycle. So that by the time it happens, you're talking about diabetes, high blood pressure, all these things are dovetailing. And if you don't have a doctor who can refer you to specialists to actually unravel those things before they turn into a Gordian knot, there's no hope. It's too late. So it's a huge problem. But for us, it's a double problem because we don't trust people look at us askance when it comes to everything. So if you don't have the fortitude and the ability the financial ability to outlast all of that and to push through all of that, there's no winning.
Courtney, why the term the invisible ache? Why do you use that term?
Because it's something that is there, that the ache for African American men is there, and we're a lot of times we're afraid to look at it. A lot of times we don't see it. A lot of times we were Dr. Robin L. Smith and myself, who is co-author of The Invisible Ache. She often talks about. We were doing a radio interview, and this gentleman said, who was sitting in on the radio interview, said, "Well, I hear all y'all, but I don't have time to take care of myself. I just got to go. I got so many people on me. I get so many people depending on me." And Dr. Robin and I looked at each other, and she quietly said to him, "I hear you, young man, but I don't think you can afford not to take care of yourself. Find the time, find a way." So it's an invisible killer. It's this lack of ability or lack of resources or lack of desire that we're not worthy to take care of ourselves. We're not, the lack of ability in these food deserts that, in certain cities, that there are no Whole Foods, there are no Sprouts, there are no Trader Joe's. And so the best they can do is go on over to McDonald's and get that Happy Meal. And, if you continually do that, and you don't have a doctor to check your numbers, when things start to happen, you just let it happen because there's no other alternative offered to you. So
But I think one of the things you articulate really well, though, is how shame covers for pain, and if you there's so much in the trauma of the Black experience that actually creates even more of a barrier than the structural barriers, and we've got to start building from both sides. Obviously, we need to find a way to actually have more doctors that look like the people they serve, because I think that's how we break down and we get color insight. not it's got to come beyond color blindness. There's
Mm.
the blindness of the healthcare system is actually creating more of a problem. But it still struck me that only 1 out of 3 African American men who would get benefit from therapy are actually going to therapy. Without your mother, would you think you would have
No,
gone and gotten help?
no, I wouldn't have known that I needed to. As I said, when I first finally started talking, I was talking a mile a minute. I had no idea that I should have been talking to someone 20 years ago or 10 years ago, 10 years prior. So no, that wasn't a part of our culture. That wasn't a part of things that we do. You just grind it out. And the thing we were talking about yesterday is that it took my father's suicide for me to go get help. It took a death, and and one of the things that Dr. Robin talks about is that we know how to suffer. We will sit in the midst of our pain and suffering because that's all we know how to do. There's no other alternative, as so we think. But to get help to do the work of healing, it's always too much work. If I do it, do I have any guarantees that it's going? But you'll stay where you are because I can guarantee you, if you stay where you are, you're gonna be dead. So that's it's a new way of thinking that has to permeate all of our culture, a new way of thinking for everyone in terms of just looking at people and dealing with people because everyone deserves good health care. Everyone deserves an opportunity to be taken care of.
So John talked about, sort of building from each side, but you've talked about also kind of revolutionizing mental health in the Black community. What would that actually take? So we're not just talking about incremental improvements.
Well, I don't know, technically what that would take because the medical industry is shifting. Doctors are having more and more on them. They come in with the same amount of debt, and in order to take care of that debt, they have to service the numbers, and in order, and so maybe they don't have time to actually do. So tell me about what's going on. How are you doing? They don't have time to do that, and so the pressure's on them. I would have to say that it's a huge issue. That really has to do with taking care of people. And in order to do that, doctors need to be taking care of themselves so that they can afford to they can afford to take care of, the one-on-one and to have a relationship with their patients. And they can, and also probably they need to be schooled about in the medical profession about their bedside manner, how you actually talk to people and engage with people that are different from yourself. And they may approach when a black person comes in, they don't know how to talk to them. And so maybe they're a little afraid, a little put off in which case the person, of color who's a patient just like, I don't want to go back to that person. They don't like me. And it's that ephemeral. It's a relationship. It's a marriage of sorts, the doctor-patient relationship, as opposed to a number. And it's looking at things a different way. And that the doctors, students, when they come out of medical school, they're probably being taught the same way. And the whole idea of the doctor-patient relationship, it's a relationship. Go ahead, John.
Court, I was fascinated by the different paths you took to heal. You explored therapy in a very open-hearted way.
Mm-hmm.
It sounds like, and I was just trying to put it in context, the way you internalized almost a meditative kind of sitting with the pain and sitting with yourself to kind of work through some of these issues. There's a lot in that in your book, but there's a lot of practical recommendations. One, get a therapist, connect with people. Don't be the stoic, tough guy that you and I grew up with, sort of assuming that was how you persevered. But also kind of sit with things. I mean, the Lao Tzu thing, you can only sit and wait. Do you want to talk a little bit about how that helped you kind of cope through and work through, tunnel through the pain, if you will?
Well, that was Dr. Kornfeld challenging me. She asked me this question. She just quietly how do you make decisions, Courtney? Because she was gathering information about how we're going to deal with, what was our relationship as a doctor-patient dynamic. What was our relationship going to be? Just establishing boundaries and, how do you make decisions, Courtney? I said, well, you're just like everybody. I flip a
Make
coin,
'em.
right?
Make
Just
'em.
isn't that what everybody does? She said, just quietly, okay, Courtney. Sometimes, there's sometimes you just got to sit there. If Courtney, do you have the patience to let the mud? Which led to her next question. Do you have the patience to let the mud settle in the water and let the water become clear?
I love that quote.
I said, hell no. What are you talking about? Well, clear water runs deep. What do you mean? No, I gotta go. I want to go. She said, okay, good to know. Good to know. And she said, finally, she said, Courtney, I'd like you to get your dreams. She said, I think first of all, she asked me, do you dream? I said, and I don't know why it wasn't until maybe a year ago that I realized probably where that came from was that's how we met. I told her that the night before we met, or a couple nights before we met, I had a dream and didn't dream. I dreamt that, but in the dream there was pattern and a fabric pattern or whatever. When I went into her office and shook her hand, I knew that was my person from shaking her hand. And then she said, "There's two sides to my office. To the right, it was a little cold, and so I didn't like that side." She said, "To the left, and there was another office area to the left, and I saw on the couch, from where I was standing, I saw on the couch there was a pillow, and the pillow was the same pattern in my dream. So I knew that was my person." And so that's where she asked me, she said, "I want you to get your dreams." She didn't tell me how, she didn't tell me what to do. She said, "I'd like you to get your dreams." I said, huh, okay. So I had to figure out how to get my dreams. I was on Broadway and I said, the new school. So there was no computer. So the new school, I said, let me go to the new school and, look in their catalog, and they happen to have Dream Workshop, Gail Delaney, Breakthrough Dreaming in a month. So I went to my stage manager and said, I feel in a month, I feel I'm going to be sick for the weekend. And so my stage manager, wink, wink, and, let the understudy know. And I went to the workshop. And so in the workshop, long story short, she basically said, in order to get your dreams, Gail Delaney, Breakthrough Dreaming, said, put a pencil, a little notebook, and a flashlight near your bed and write down the first thing you think of when you wake up. Doesn't have to be a dream, but you're training your mind to go, where was I? So I did that. And after the third night of gibberish writing down, the dreams came through. Boo, 7 dreams came through. And I had to go to bed by 9:30. I slept solid till 2, woke up at 2. Then from 2:30 to 6:30, I slept dreams. So what happened is that I came in the next session with 35, 40 dreams. And I said, bam, challenge me again.
Because the dreams are illuminating. Do
Mm-hmm.
they help you work through your path?
The dreams, that's how we did our sessions. We worked off my dreams. There was no editing. There was no, well, I think that she said, Courtney, but it's too many dreams for me. That's who you are. Okay. I acknowledge you're amazing. Okay. So choose one dream and bring it to me and work off that dream. So for the next 3 years, we worked off my dreams. And she said, we invited her to our wedding, Angela and I. And she pulled me aside in the reception. She said, Courtney, we did some amazing work. I said, wait a minute, you have hundreds over the years clients. So you saying me, little old me? She said, Courtney, we weren't on the couch, but you were working directly off your subconscious. So I could see. I remember I brought her one dream about Natalie Cole and the State House, and she said, let's do 2 sessions a week now, Courtney. And I said,
Well,
I didn't ask why. I didn't say, well,
amazing.
what's going on? I just said, okay. So, because she probably saw I was starting to fracture. And she said, let's do 2, because it was my time. And so I embraced, this is what we're getting at. I embraced this journey that I was on. I did. I had two things I had to do in my life at that point. Three things. I had to work. I had to take care of my dog Bottom, and I had to do my therapy. I had to go to bed because when I went to bed, I got my dreams, and when I got my dreams, I was able to come into my session and go, okay, here we go. Here's the most powerful one. She said, Courtney, what does that mean? Huh. Okay. Well, in the basement, all my dreams were sports related because I was a jock in high school. It was either on the basketball court, a football
Pretty
field,
damn
or
good jock, actually.
yeah, well, yeah. So, but that was I'm using all of myself for my healing, and basically it has to be about you embracing you. I got into it.
And that's what's inspiring is you open
Mm,
your heart to whether it's your relationship with Angela or the
mm,
dreaming. Can you maybe, I mean, obviously she's been really critical at I'm sure every moment, but in critical moments. But the other thing that was inspiring is you talked a little bit about faith. How important was faith in terms of serving as a foundation, your for your healing?
it was everything, and that was the my father's suicide was the first phase, getting myself ready for to be ready to be a husband and a father. And then when I became a husband and father, we did 9 weeks of premarital counseling. I thought I was ready, but I wasn't. And so I found myself nervous breakdown, anxiety attack, whatever you want to call it, in a hospital bed, tears running down my face, feeling all the failure of a man in the first 3 years of our marriage. And I heard Angela whisper, the doctor whispered to Angela, Dr. William Young, God rest his soul, said, there's nothing physically wrong with him, but I know of a great psychiatrist. And I said, and the Lord whispered to me at that point, I heard it saying, are you ready now? And I had a godly counselor who was working with me, working me out. And he was telling me, Courtney, you gotta get in the Bible. You gotta read it for yourself. You gotta know, you gotta get ready for your wife. You gotta get ready. And I said, yeah, doc. Yeah, doc. And I said, God, I know what I need to do. I'd take me home. And we went home, and I did everything I had to do, David, John. I had to, my wife liked flowers in the house, went to the flower mart every Tuesday and brought flowers in that house and arranged them around and went to the jobs I had to do, did those, took care of, all the things I had to take care of.
Business.
And in my free time I was in that book. So much so that when somebody brought a book for me to read, Angela snatched that book away from them. This is after, a year, snatched that book away from me and said, he don't read no book but the Bible. Give me that book. Maybe I'll read it. And after I got to because I needed a word. I
Yeah.
needed to know how to deal with Angela Evelyn Bassett, how to be the man that I said I was going to be. I said I was. And she was waiting for me to be that man. And she was literally just
God
watching
bless
me.
her. God
Yes.
bless her.
So she, the Bible actually, when I finished it the first time through, I went back and started over and went cover to cover, started taking notes. So about 5 or 6 times I went through the Bible, and in that journey, because it's a journey. Life is a journey. It's not, you're not going to solve something and then you've arrived. It's a journey. You have to get that perspective that I'm on a journey for myself, and that is there was no achieving. There wasn't. This is now just life. This is quietly, who are you? How do you want to be perceived? What do you? And I've realized after going through that journey of reading that book that I'm here to help. What do you need me to do? You need me to. What you need me to do? And when the children came, serving, the power of submission, all of those lessons
Which is
came. It's
particularly
huge.
for a star in a star-driven world that you're in,
Hmm.
that message, the power of that narrative of service comes across. And I think we can't cover everything that's so beautiful in your book, but what was powerful for me as someone who's an old friend, was how much you shared. And I think that to me is the door in to getting help, to getting care, to getting kind of understanding yourself. And I'm just so powerfully, I think
I
we're
was
all honored by the
I was
book.
the realization came to me that once the hardest thing is to acknowledge I need help, to say it. And once you say it, all of a sudden, all these people came forward with, Courtney, I have this great person. I just wondered if, Laura Linney, God bless her. She was an understudy on 6 Degrees of Separation. We all stayed. She was there the entire time we were doing it. And when I came back with my mom, she said, Court, I have a therapist, massage therapist, because she knew in between shows on Wednesday and Saturday, I got massages. She said, her name is Gunilla Asp. Go see her. And I did. And that's how Dr. Kornfeld and I found each other.
It's amazing that you shared. I mean, it's hard as a guy. It's particularly hard as an African-American male. And to me, Court, that's the message that I really wanted folks to hear in CareTalk, but also the world, because it is, you've honored us with your vulnerability, but I want to turn it into a call to action.
Well, that's it for yet another episode of CareTalk. Our guest today has been Courtney B. Vance, author of The Invisible Ache, Black Men Identifying Their Pain and Reclaiming Their Power. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health and the senior advisor at Walgreens. Thank you so much, old friend Courtney B. Vance.